But in 1976, when we had a swine flu epidemic starting out at Fort Dix, New Jersey, we did have a reasonable vaccine available, which however was not safety tested, and a certain number of patients developed Guillain-Barré syndrome, and actually some of them died because of the vaccine. So again, we need some better vaccine producing facilities, but we also need better systems of testing these vaccines before we start using. Next one. Now, one of the major epidemics which occurred after World War II was an epidemic, typhus epidemic, and typhus usually kills a large number of patients, but a number of patients recover. And then some weeks later, the disease comes back again with renewed syndrome, and that is called the Brill-Zinsser disease, which killed a very large number during World War II. I was in a Russian prisoner of war camp and helped the one little Russian lady who was a camp doctor taking care of these patients. And we had a terrible time. We didn't have adequate facilities, and a huge number of the inhabitants of that camp actually died of that disease. Interestingly enough, of course, the Russians were our allies, and we supplied the Russians with some DDT, which was thought to be a wonderful insect killer. But it turned out that DDT had no effect on the lice which spread epidemic typhus. They were only susceptible to melathion and lindane, which was not available at the time. So we had some major problems. Today we know that epidemic typhus is susceptible to chloramphenicol and tetracyclines, but those drugs were not yet available. There are vaccines against this disease, but not readily available because the disease is virtually not present anywhere and the vaccine is not needed. One of the problems we have that for diseases for which there's not great call, the pharmaceutical companies are not making vaccines, and when one of these epidemics strikes, we have no protection. So again, we need a system where we would make arrangements that even relatively rare vaccines are being produced. They are bought by the government, stored by the government, and available when needed. We also need increased facilities to make vaccines. For example, with the flu, the swine flu, which is going around now, presumably with all the pharmaceutical companies, both here and in Europe, which are working on it, we will have 1 billion doses. But yet humanity has over 6 billion people. So if we have a major epidemic, we may still have some major deaths. In the Spanish flu after World War I, the way it went that in the early spring there was a great deal of disease, but it was mild. Very few people died. During the summer there was very little disease, but yet people passed the viruses on from one to the other, and the virus underwent mutations. And in the fall, it came back with full power. By that time, it mutated, and there was a very high incidence of death. And as I said, probably 100 million people died throughout the world. Now, this is the sort of problem we may have now. We had in the spring some of these new swine flu incidents, very few deaths. And the people who had the disease and recovered are probably lucky because they are now immunized. So we may have a second wave coming along in the near future, which might have mutated and may have a high mortality. And again, we will have some vaccines available, but probably not enough. Next. Now, what kind of problems are produced by wars are shown by an example. Now, this is a patient who came to my clinic not terribly long ago. He was a veteran of the Vietnam War, where he was exposed to Agent Orange and also had some gunshot wounds from which he recovered. But when he came to my clinic, he had pulmonary nocardiosis, which is a major fungal disease of the lung, with ileal abscesses. He had thrombophlebitis. He had various fungal infections, but he also had a number of diseases which were probably unrelated to his wartime experience. He had tunnel syndrome, he had arthritis, he has diabetes mellitus type 2, with neuropathic syndromes. He had a first-degree heart AV block. He had some hearing defect. But interestingly enough, he also had hemochromatosis. And when we analyzed his DNA, we found a typical DNA change, which is characteristic for hereditary hemochromatosis. But yet this fellow was 56 years, and until that age, he had no symptoms. Now, he might have developed these mutations because of exposure to Agent Orange, but we are not sure. He also had adenocarcinoma of the lung, widely metastatic. Again, the question is, if cancer is a mutation, would that mutation be induced again by Agent Orange? He had the appropriate laboratory changes to all of these diseases he had. But one of the interesting findings we had, which was part of our research approach, was that he had a very high alpha beta circulating interferon receptor level, which captured all the interferons and made interferon defense impossible. So here is a gentleman with a tremendous list of diseases, some of which might have been related to his wartime experience, some might have not, some might have been accelerated by wartime experience. But these are the sort of problems we see today. We seldom see a patient who has one disease. When we do a careful workup, we usually find a large spectrum. Next. We do have some good results of which we can be proud. For example, not very long ago, severe acute respiratory syndrome occurred and killed a large number of patients in southern China in the early 2000s. And it was discovered that this is due to a new virus, which is called SARS coronavirus. And it turned out that this is a virus whose reservoir is in the horseshoe bats. But the horseshoe bats infect the palm civet, which is a jungle small rodent, which is taken to the Chinese markets and sold for food. And as people prepare this food, they get infected, and they got infected with SARS. So there is a good epidemiologic study which, within a very short time, discovered the reason and the epidemiology of this disease. And all they had to do is to bring some rules that no jungle animals can be brought to Chinese markets, certainly no palm civets, and with that the disease disappeared. So even though in the early days it killed a lot of people, now SARS doesn't exist anymore.